Welcome to another deep dive. And this time, you guys have really given us a challenge. We're going to be diving into child maltreatment in Puerto Rico.
Yeah.
And we've got a ton of material to get through. We've got a doctoral dissertation, a bunch of legal analyses of legislation in Puerto Rico, and even program directories. And all of this spans from January 2015 to December 2020.
Wow.
So
That's quite a time frame.
it is. It is. And especially considering Hurricane Maria hit smack in the middle of all that. So it's we know we're dealing with a pretty complicated landscape here.
Yeah, it is a very complex issue. And what's really fascinating about this dissertation is the way the author approaches it. They dedicate their work to someone that they lost due to a reactive healthcare system.
Oh.
So, it really drives home the urgency of preventative measures.
Yeah, that's a powerful statement. It really makes you realize we're not just talking about abstract statistics here. These are real lives.
Yeah.
But speaking of statistics, I mean, the dissertation does paint a pretty stark picture, doesn't it?
It does. It does. Between 2018 and 2021, neglect was the most common form of maltreatment in Puerto Rico.
Okay.
And what's really interesting here is that physical neglect actually overshadows physical abuse. Almost 40% of reported cases were physical neglect.
Wow, that's a lot higher than I would have guessed.
Yeah.
And it's followed pretty closely by emotional and educational neglect. I mean, what does it tell us about, how we even understand and address child maltreatment?
Yeah, I think it really suggests that we need a much broader perspective when it comes to addressing child maltreatment.
Yeah.
Often we focus on those really visible forms of abuse, like physical abuse or sexual abuse. But these statistics really reveal kind of a hidden epidemic of neglect
Yeah.
that can have just as devastating consequences.
Right, because neglect, in all its forms can have those ripple effects throughout a person's life.
Right.
And it's similar to what we've learned about adverse childhood experiences, or ACEs, here in the U.S.
Exactly. ACEs encompass a range of experiences, including neglect, and they've been linked to, all kinds of negative outcomes in adulthood, like chronic health problems,
Yeah.
substance abuse, mental health issues. So really, understanding and addressing neglect, it's absolutely critical. And that brings us to the policy landscape in Puerto Rico during those years. So the dissertation analyzes 35 different bills passed in Puerto Rico using what's called the CEPL model, which evaluates how effectively policies move from the planning stage to actual impact.
Gotcha. So instead of getting bogged down in the details of, what the CEPL model is and how it works, can we just jump right into some specific examples? Were there any policies that stood out to you as either being really successful or failing miserably under this model?
Absolutely. One bill that caught my eye because it was successful actually improved access to services for minors who had experienced sexual abuse. However, it lacked a trauma-informed approach, which, as we'll talk about later, is really, really key. And then there's another one that also caught my eye because it aimed to create reading programs across the island.
Interesting.
Linking early literacy to emotional development.
Oh, so that's interesting. So it sounds like that bill was taking kind of more of a preventative angle.
Yes.
Trying to address some of those root causes we were talking about earlier.
Right, but that bill, unfortunately, didn't have the impact that lawmakers had hoped for. There was just a lack of adequate funding and infrastructure for widespread implementation.
Gotcha.
And that kind of speaks to a larger trend that the dissertation highlights, which is this tendency towards a very reactive approach to child maltreatment rather than a proactive one.
Okay.
So there were a lot of bills focused on responding after abuse or neglect had already occurred.
So it's kind of like putting a Band-Aid on a wound without addressing the infection underneath.
Exactly. And this is where looking at what other countries are doing can be really insightful. There are some countries out there that have had a lot of success in tackling child maltreatment.
Okay. With a much more preventative approach. So take Ireland, for instance. They have a law called Children First.
Okay.
And it puts a huge emphasis on early intervention and family support.
Interesting.
Really trying to create a safety net before families reach a crisis point.
Makes a lot of sense. But, laws are only part of the equation, right?
Right.
We need to hear from the people on the ground, the people actually working with children and families.
Yeah.
And that's where this Delphi study comes in.
Yeah. So the dissertation uses what's called the Delphi Method, which basically gathers expert opinions to try to achieve a consensus.
Okay.
In this case, they got insights from 27 different specialists in child maltreatment policy.
Wow. Okay. And so what did they say? Did any clear themes or recommendations emerge from all these discussions?
Yeah, overwhelmingly, they emphasize the importance of trauma-informed care. So they argued that asking what's wrong with you
Yeah.
is not enough. Instead, we need to ask what happened to you. That's a powerful shift in perspective for
Well,
sure. It really moves us away from blame and towards understanding.
exactly, exactly. And they also stress the need for better data collection
Yeah. Wow.
to inform these policies. Because without accurate, comprehensive data, it's really hard to know what's working and where to focus resources.
Yeah, it's like measure to manage,
Oh,
right?
exactly.
I like that. But, data and trauma-informed care, those are kind of big picture concepts. Were there any specific models for change that these experts actually recommended?
Absolutely. They highlighted the importance of models that kind of go beyond policy and offer more concrete solutions.
Okay.
So one that they really endorsed was trauma-focused cognitive behavioral therapy, or TFCBT.
Okay.
It's a therapy that helps children process and cope with traumatic experiences, and it's especially effective when parents are involved.
So instead of just treating the child in isolation, you're giving the whole family the tools to kind of heal and move forward together.
Exactly. And that's all part of what the experts called for, that systemic approach.
Yeah. Yeah. Yeah, that makes a lot of sense. Okay, but before we go too far down that road, I want to circle back to those 35 bills that the dissertation analyzed.
Sure.
Did the research kind of break those down into specific categories based on the issues that they were addressing?
They did, yeah. A significant portion of those bills were actually focused on sexual abuse,
Okay.
which, is understandable given the really devastating and long-lasting effects of that type of maltreatment.
Right, but, focusing solely on those most extreme cases kind of feels like we're just playing whack-a-mole, right?
Hmm.
Like,
Yeah.
shouldn't the goal be to prevent those situations from arising in the first place?
Absolutely. And that's where those international examples that we touched on earlier become really important.
Yeah.
The countries that have had success tackling child maltreatment have done so by addressing those broader social determinants of health.
Oh.
Things like poverty, lack of access to quality education, just limited support for families in general.
Yeah. So it's not just about tweaking laws. It's about creating a society where children are supported and protected at multiple levels.
Exactly.
Okay. So did the experts in the Delphi study kind of echo that sentiment?
They did. They did. One of their top recommendations was a focus on early childhood development.
Okay.
And the science is really clear on this one. The first few years of a child's life, they're absolutely critical
Yeah.
for brain development, for emotional regulation, and forming those healthy attachments.
It's like laying the foundation for a strong and resilient building, right?
Exactly.
If you skimp on the foundation, the whole structure is going to be weaker.
Precisely. And one of the things that they highlighted was the need for affordable, high-quality childcare,
Okay.
which would not only benefit children's development, but would also allow parents, especially mothers, to participate in the workforce.
Right. So it's an economic issue as well as a social one, right? Investing in early childhood development could have all these positive ripple effects across society.
Absolutely, and it ties back to that idea of addressing those systemic factors that contribute to child maltreatment. Because when families are struggling financially, it creates this cascade of stressors
Yeah.
that can really increase the risk of neglect or abuse.
Now, the Delphi study also highlighted the need for better training for those professionals who work with children. What would that training entail?
Well, it would definitely include a deep understanding of child development and the impact of trauma, but it would also go beyond that.
Yeah.
Professionals need to be trained to recognize those often subtle signs of maltreatment.
Yeah.
They need to know how to respond in a way that's sensitive and supportive, and also to be able to connect families with the resources they need.
So it's about equipping those professionals with both the knowledge and the skills to not just spot the problem, but to take action and offer real help.
Exactly.
Okay. Did the experts delve into any specific types of training or programs that they thought would be beneficial?
They did. They talked a lot about the importance of trauma-informed care training, which helps professionals understand the impact of trauma and create environments that are safe and supportive for children who've experienced adversity.
Okay.
And they also talked about the need for ongoing training, to make sure that professionals stay up to date on best practices
Right.
and evolving research.
That makes a lot of sense. We wouldn't expect a doctor to, practice medicine based on knowledge from 20 years ago.
Right.
So why would we expect any different for the professionals working with children and family?
Exactly. Exactly. The field is constantly evolving,
Yeah.
and professionals really need to be equipped with the latest knowledge and tools to be effective.
Now, as we were going through all of this material,
Mm-hmm.
one thing that really struck me was the lack of focus on the role of fathers.
Mm-hmm.
It seemed like most of the discussion was really centered around mothers and their experiences. Was that just my perception, or was that a trend in the research as well?
No, you're right to point that out. It was definitely a trend in the material we reviewed,
Right.
and it's something that really needs to change. Fathers play a vital role in children's lives,
Yeah.
and their involvement is just as crucial as mothers when it comes to preventing child maltreatment.
So how do we shift that narrative?
Hmm.
How do we encourage fathers to be more actively involved? Because, it seems like there's still this very strong societal expectation that caregiving is primarily a woman's responsibility.
Yeah, yeah, and challenging that norm is essential.
Mm-hmm.
It requires a multifaceted approach.
Okay.
We need policies that support fathers, things like paid paternity leave, flexible work schedules.
Okay.
We also need programs that are specifically designed to engage fathers and provide them with the knowledge and skills they need to be active and nurturing parents.
Right. And it's not just about fathers, right?
Right.
It's about recognizing and supporting all caregivers,
Mm-hmm.
regardless of gender or family structure. Every child deserves to have those loving and supportive adults in their lives.
Absolutely. It's about creating a culture where caregiving is valued and shared,
Yeah.
and where all families have the resources that they need to thrive.
Now, the dissertation didn't just focus on policy,
Right.
It also included a pretty in-depth analysis of the programs and services available in Puerto Rico
Mm-hmm.
that address child maltreatment.
Mm-hmm.
So that includes things like shelters, counseling services, educational programs.
Yeah.
What stood out to you from that analysis?
One thing that was really striking was the geographical disparity in access to services.
Mm-hmm.
Rural communities often lack the resources that are available in urban areas, which means that families in those communities may face significant barriers to getting the help they need.
That's a common problem in a lot of places, right?
Mm-hmm.
Even if well-intentioned programs exist, they may not be accessible to the people who need them the most.
Exactly.
Did the dissertation offer any potential solutions to kind of address that?
It did. It highlighted the need for more creative solutions, like mobile services that can reach families in those remote areas,
Okay.
telehealth options that can provide support remotely,
Yeah.
and, just partnering with community organizations that can extend the reach of existing programs.
So it's about meeting families where they are,
Yes.
both literally and figuratively, right?
Mhm.
It's about recognizing that a one-size-fits-all approach isn't going to work when it comes to addressing such a complex issue.
Exactly. And it's also about being culturally sensitive in the way those services are delivered.
Yep.
Puerto Rico has its own unique culture and traditions.
Yeah.
And those need to be reflected in the programs and services that are offered.
Right. It's not just about translating materials into Spanish.
Mm-hmm.
It's about understanding the nuances of family dynamics and child rearing practices and community values. It's about ensuring that those services are truly accessible and relevant to the families they're intended to serve.
Absolutely. And that leads to another critical point that was highlighted in the dissertation. The need for a more coordinated and integrated approach to child maltreatment services.
What do you mean by coordinated and integrated?
Well, it's about breaking down those silos between agencies and professionals.
Okay.
Healthcare providers, educators, social workers, law enforcement, all these different groups need to be working together, sharing information, and coordinating their efforts.
So right now, it sounds like all these different entities are kind of operating in their own separate bubbles.
Yeah, that's often the case, unfortunately.
Yeah.
And it can lead to, fragmented services and missed opportunities for intervention.
Okay.
A more integrated approach would involve clear communication channels, shared protocols, and really just a common understanding of the issue and the best ways to address it.
Right. So instead of each professional or agency working in isolation, they're part of this larger team,
Exactly.
all striving toward the same goal.
Exactly. And that kind of collaboration is essential for creating a truly effective system of support for children and families.
Okay, so we've covered a lot of ground already.
Yeah.
We've talked about the human impact of child maltreatment,
Mm-hmm.
the policy landscape in Puerto Rico, the need for better training for professionals, and a more integrated approach to services.
Yeah.
But there's another piece of the puzzle we need to consider, and that's the economic impact. This isn't just a social issue.
Right.
It has some serious economic implications as well.
You're absolutely right. The cost associated with child maltreatment are just staggering,
Yeah.
both in Puerto Rico and globally. We're talking about billions of dollars spent on healthcare, social services, the criminal justice system, and just lost productivity in general.
So it sounds like addressing this issue, it's not just about doing what's right for children.
Mm-hmm.
It's also a smart economic decision.
Precisely. Studies have shown that investing in those prevention and early intervention programs can actually lead to significant cost savings in the long run. So, for example, providing home visiting services to at-risk families can reduce the need for more expensive interventions later on, like foster care placement.
Right. It's that old adage, an ounce of prevention is worth a pound of cure.
Exactly.
But what about the cost of dealing with, the consequences of child maltreatment after the fact?
Oh, yeah.
I mean, those must be significant, too.
Oh, they are. They are. Think about the healthcare costs associated with treating the physical injuries,
Yeah.
the chronic illnesses, the mental health problems that can stem from childhood trauma.
Mm-hmm.
Then you have the cost of special education services, juvenile delinquency programs, and even the lost productivity of adults who experience maltreatment as children.
It's like this ripple effect, right?
Yeah.
The costs just kind of spread outward across society,
Exactly.
impacting us all in different ways.
And it's important to remember that those are just the quantifiable costs.
Right.
There's also those immeasurable costs. The pain and suffering of victims, the loss of human potential, the erosion of trust in relationships and communities.
Yeah, it's a sobering thought, but it really underscores, the urgency of addressing this issue.
Absolutely.
And I feel like, knowing the full scope of that economic impact should be a really powerful motivator, not just for policymakers,
Right.
but for the public as well.
I agree. It's an investment worth making, not just from a moral standpoint, but from an economic one as well.
Now, I want to circle back to the dissertation's analysis of those 35 bills passed in Puerto Rico between 2015 and 2020. And you mentioned earlier that, the results were kind of mixed in terms of their effectiveness. What factors contributed to the success or failure of those policies?
Well, one key factor was the design and implementation of the laws themselves.
Okay.
Some laws, despite good intentions, were just poorly designed or
Okay.
implemented, which really limited their impact. So, for example, a law might have lacked clear guidelines for implementation,
Okay.
or it might not have been adequately funded to actually achieve its goals.
So it's not enough to just pass a law.
Right.
You need to make sure that it's well crafted,
Yes.
adequately funded, and implemented effectively.
Yes. Very important.
That sounds like a pretty tall order.
It is, but it's essential if we really want to see meaningful change. And it brings us back to a point that both the dissertation and the Delphi study really emphasized: the need for a more coordinated and integrated approach to child maltreatment.
Right. We talked about that a little bit earlier, but can you elaborate on what that would look like in practice? Like what concrete steps could be taken to create a more integrated system?
Well, one key step would be to establish those really clear communication channels and shared protocols between all those different agencies and professionals that are involved in child maltreatment cases.
Okay.
That would ensure that everyone is really on the same page, working together toward that same goal.
Because right now, it sounds like there's a lot of siloing happening, right?
Mm-hmm.
Like these agencies and professionals are kind of operating in isolation
Yeah,
without much interaction or collaboration.
that's often the case, unfortunately.
So fostering collaboration and communication is key.
Absolutely.
What else could be done to improve this system?
Another important step is to provide comprehensive training for all professionals who work with children,
Okay.
ensuring they have a deep understanding of child development, the impact of trauma,
Mm-hmm.
and just best practices for preventing and addressing child maltreatment.
So it sounds like we're talking about a pretty fundamental shift in the way we approach this whole issue, right?
Mm-hmm.
Moving away from that reactive, siloed system
Yeah,
to a more proactive and integrated one.
exactly. And that shift really requires a commitment from all stakeholders, policymakers, professionals, communities, and individuals.
Yeah.
We all have a role to play in creating a world where children are safe, nurtured, and empowered to reach their full potential.
That's a powerful message. And it brings us to the end of our deep dive into child maltreatment in Puerto Rico.
Oh,
We've covered a lot of ground today,
we have.
from the human impact to the policy landscape, the economic costs, and the need for, more integrated and preventative approach.
Yeah.
What's the most important takeaway you want our listeners to walk away with?
I think the most important takeaway is that child maltreatment is a complex issue,
Hmm.
but it's not an insurmountable one.
Okay.
By understanding those root causes, investing in prevention and early intervention, supporting families, and really creating a culture that values and protects children, we can make a real difference.
Well said. And remember, listener, you don't have to be a policymaker or a professional to make a difference.
Right.
You can volunteer your time at a local organization, advocate for policies that support families, educate yourself and others about the signs of child maltreatment,
Hmm.
and most importantly, be a voice for children in your community.
Absolutely. Every action, no matter how small, can contribute to creating a world where all children thrive.
Hmm.
The future belongs to our children,
Mm-hmm.
and it's our responsibility to ensure that that future is bright.
This has been a really insightful deep dive,
It has.
and we hope it's inspired you, our listener, to learn more and to take action.
Yes.
Thanks for joining us.